Hi everyone, Dr. Chitra here, your mentor at Study Medic and Study MRCOG, and we are back with our exam ready series. So this time, in this video, we will be seeing how to do a station from the module Oncology. Okay, and we have Dr. Soumya as our examiner and Dr. Vaishnavi who's going to be the role player. Okay, so this is a simulated patient task. Go through the candidate instructions very carefully in 2 minutes. See what you are expected to do. Make sure that you are reading the histology report that is given. Make sure that the number, NHS number, the age, everything matches. Note it down in your 2 minutes. What else you will be going to talking to the patient, to the role player, all that you have to note. And then you will start. Okay. So I think let us start. Vaishnavi, are you ready?
Yes.
Yes, Dr. Samya, can we start?
Yes, please, Chitra. Yeah.
All right. Hi, this is Dr. Chitra, one of the senior doctors in the clinic. Am I talking to Maria?
Yes. Yes,
Maria,
doctor.
Can you confirm your age, please?
I am 67-year-old.
Okay. Maria, how are you doing today?
I am fine, doctor.
I understand that you have undergone a procedure. Tissue sample has been taken from the vulva.
Yes.
And how are you coping up with that?
I am fine now. No complaints regarding that.
Okay. No pain, bleeding?
No.
So we are here to discuss the results of that tissue sample if you are ready.
Yes, doctor.
Maria, do you want someone to be with you during this consultation? Because I have a lot of important things that I would like to discuss.
No, doctor. I am fine alone.
So Maria, I have confirmed your name, your age and NHS number on the report that is there with me. And I can confirm that this report belongs to you.
Yes.
So Maria, I'm sorry, I'm really sorry. I don't have very good news for you today.
Oh.
So the report says that you have cancer of the vulva.
Oh. Doctor, please give me 1 second.
I'm really sorry, Maria. Would you like to have a glass of water? Yes.
Yes, doctor.
So Maria, if you're okay, we can go ahead with the consultation today, or you can come back with someone to at a later date.
No, doctor. I am fine now. You can tell me.
I am really sorry that I have to be the bearer of this bad news. But let us go ahead and let us discuss what are your management options. Is that okay with you?
Yes, doctor.
Before we do that, I would like to know a few things about you so that I would know you better. Okay.
Yes.
Can you tell me, Maria, what exactly led you, to having this tissue biopsy?
Doctor, I was having burning sensation and itching in the lower part of my body. And then I rushed to GP. He advised me to do the tissue biopsy. I had some fine mass in that area, and he advised me to get the biopsy done. And he gave me the report, so I visited your clinic.
For how many days did you have this?
Since last 2 weeks.
Was it associated with any itching?
Yeah, it was associated with itching.
Okay. And anything else like difficulty in passing urine?
No,
Any other symptoms at all?
no,
Like
doctor, no
with your
other
bowel?
symptoms.
Okay. Okay. So, Maria, apart from this, are you following up with your GP for any other condition?
Yes, doctor, I have diabetes, and it is since last 3-4 months. I am following with him. I am currently on the insulin treatment.
And are you taking your insulin medications regularly?
Yeah, I'm taking it regularly.
Okay. Um, any other operations that you have undergone in the past?
No, I didn't underwent any operation.
Okay. A few personal things. What about your periods?
My periods has been stopped since last 15 years.
Okay. Any medications you are on, like for control of any symptoms, like something called as hormone replacement therapy?
No.
And what about your cervical screening or pap smear? Were you regular with that?
Yeah, I was doing that smear testing regularly and it was normal.
Okay, that's good to know. A few personal questions, Maria, if you don't mind.
Yes, doctor, sure.
Do you smoke?
No.
What about alcohol?
I I do drinking
Alcohol?
occasionally, but I never smoke.
Okay, okay. What about any drugs
Yeah.
for fun?
Occasionally I do alcohol consumption. No.
Okay. Do you have any allergies?
No, doctor. I don't have any allergy to any kind of food or any medication.
And whom do you stay with?
I stay alone. I don't have kids. I
Okay,
stay alone and
okay. So any
sometimes my
support
friend.
system? Mm-hmm.
Sorry.
Any support system that you
Yes,
have?
you can. I have friends who
All
support
right,
me.
all right. Mhm. A very personal question, Maria. Are you sexually active?
No, doctor.
Okay. So to summarize, Maria, you had some itching down below and a mass. So for that, you have undergone a tissue biopsy. A tissue
Yes.
sample has been taken, and it shows that you have cancer of the vulva, and you have a condition called as diabetes for which you are taking insulin. Apart from that, is there anything else that I should be knowing?
Yes.
Okay. One more question. What about your blood group?
No, doctor.
What
My
is your
blood group
blood
is O
group?
positive.
Okay. Any reservations for blood transfusion?
It is O positive.
Any reservations for blood transfusion?
It is O positive.
Yeah. Do you have
No,
any
doctor.
reservations for blood transfusion if needed? No. Okay. Thank you.
No.
Can we go ahead and discuss your management options now?
No. No.
Okay.
Yes.
So, Maria, since you have cancer of the vulva, your care from now onwards, it will be taken care, it will be in the hands of a team of doctors. Okay. My consultant, there will be
Okay.
specialist doctors called as the gynecological oncologist. Your GP would be kept in the loop. There would be a specialized nurse called as the Macmillan nurse, a doctor who specializes in giving medicines for cancer patients known as a chemotherapist, and also a doctor who specializes in giving another form of treatment called as radiotherapist, and a doctor who would be doing imaging studies on you. Okay, all these people would be taking care of
Okay.
you. Am I clear?
Okay, doctor. Yes.
So before we embark on any of your treatment, we would like to do a few more tests on you. Okay,
Okay.
called as an MRI or a CT scan to know if the cancer has spread to any other parts of your body.
Okay, doctor.
Okay. And depending on that, the further management plan would be decided.
Okay, doctor.
Okay. So, usually for cancer of the vulva, it is usually a wide local excision, means we try to take out as much of the mass that is present and a little bit of normal tissue around it. And that is subjected again to another examination under the microscope. Okay.
Okay.
And
Okay.
depending on what would be the result of that, the tissue that has been entirely taken out, it would be decided whether you need further treatment in the form of medicines called as chemotherapy, or whether you would be needing radiotherapy.
Okay, doctor.
Okay. Am I clear to you?
Yes. I have a
So, any
concern.
doubts?
Yes.
Yes.
How long I am gonna live?
Well, Maria, we have fortunately picked up this cancer at a very early stage. It looks like at a very early stage. And with modern day medications and the good surgical options that we have, I think you need not worry. We will try to give you the best treatment possible.
Okay.
Okay? Am I clear to
Okay.
you on this? Okay.
Yes, doctor.
Now, coming to the risks of surgery, there could be a little bit of bleeding, or there could be a risk of infection. Some pain would be there. Okay. And
Okay.
we would have to take care of that. The medicines that you would be given, like chemotherapy, though we have good medications now, sometimes those medications could make you feel a little bit sick. You might want to throw up, or you might lose your hair. Okay. But that would
Okay.
be taken care of by medicines. Okay. And if at
Okay.
all you need radiotherapy, because of the effect of radiotherapy, there could be a little bit more of soreness on the vulva.
Okay. Got it.
Okay. So if I have answered all your questions and you have no more doubts, I would like to give you these patient information leaflets. You can go through them. I would put you in touch with a nurse called as the Macmillan nurse who would be there with you. You can talk any of your concerns with her. And another thing, Maria, if you would feel better talking to someone, okay, known as a counselor, okay, because I know this is too much to take in the diagnosis of cancer. So if you would feel better talking to a counselor, I could arrange that for you.
Yes, doctor. I would like to visit a counselor.
I would do that for you. And in the meantime, I would arrange for further scans, and also I would write to the multidisciplinary team for your forward care, for your onward care.
Okay, doctor. Okay.
Any other questions that you would like to ask me?
No, doctor.
Okay.
Thank you,
So
doctor,
thank you, Maria. Thank you,
for
Maria, for
taking
your time.
time to explain everything so clearly and patiently. Thank you, doctor.
Thank you, Maria. I think I'm done.
Yeah, I think you just shooted like 10, 20 seconds, so that's why I didn't stop you.
Okay.
Yeah, Chitra, I think that was a well done station. Only thing what I felt was there was sympathy, empathy, but probably a little bit of modulation of the voice. Otherwise, I think it was
Okay.
fine, especially when she asked about how long am I going to live. So probably that is where I wanted the empathy in the voice and modulation. Otherwise, whatever you said, obviously you said that that's something in early stage. So before that, you could just mention that you are in the safe hands. You will be doing the best or something like that. Other than that, I
Okay.
think
Okay.
you have covered mostly everything, and it was a well done station because, of course, the role players would be very melodramatic and they would take a lot of time.
Yeah.
So I think otherwise it's fantastic. Yeah.
Okay. Yeah. Thank you so much. Thank you so much. All right. So let us go and see what are the important points in each domain and what would be the marking system like. Okay. So first coming to information gathering, you have to ask about the complaints, about the duration, progressing, itching, pain, discharge, bleeding, background history, very important, any comorbidities like diabetes, hypertension, anything, impact on daily life, the quality of life or sexual activity, about the biopsy, if she knows anything at all, and any associated symptoms, urinary, bowel. It's very important also to ask about pap smears. Don't forget to ask that. Okay. So if you fail to ask about current symptoms, or you assume that the role player already knows what is the diagnosis, you don't ask about the relevant medical history, diabetes, immunosuppression. You are not you don't understand what are her concerns, or the psychological aspects are totally ignored. Then you would lose points in information gathering. Now, coming to communication, remember in oncology, it would mostly be breaking bad news. So you have to follow all the principles of breaking bad news, like giving a warning shot, then one or two warning shots you can give. Ask the role player whether she needs any support during the consultation. Then tell her what it is and tell the diagnosis. Don't beat around the bush. Okay. If it is cancer, you have to tell her that it is cancer. Wait for 20-30 seconds for the role player to like reveal their emotions, and then go ahead. Like, don't totally ignore if the role player is not feeling good, if she's trying to cry, or just don't go ahead with your consultation. You will definitely lose points there. So there has to be a lot of empathy, and that should reflect in your tone. Okay, talk in layman's language as far as possible. Check the understanding of the patient very regularly, and give reassurance, but don't give false hope. Okay. So if you use medical jargon, like if you say it is keratinizing squamous cell carcinoma, or if you say it is neoplastic atypia, normally she will not understand what it is. But cancer is something that they do understand. Everyone knows what is the meaning of cancer. Don't run behind your own agenda. Any question that the role player is asking you, it has to be addressed. Okay. And give addition, if you fail to address the emotional response, if you are giving too much technical details without giving any empathy, you do not confirm what is the understanding of the patient, then your communication skills are also not good. Now, patient safety. Allergies are something that you cannot afford to miss in any of the station. Any patient that is going to undergo surgery, you will have to ask the blood group, any reservations for blood transfusion. Okay. And also in oncology, please don't forget that you will refer her to the multidisciplinary team or the oncology team. It is as an ST5, you cannot manage any oncology patient. Always you will have to refer her to the multidisciplinary team. Tell what is going to be the likely management plan, whether it is going to be surgery, chemotherapy, or radiotherapy. You want to document everything clearly, and this is only a biopsy that usually they come. So you want to know the full staging. So how that is going to be done, because depending on the staging, then the future treatment is going to be planned. Okay. And always give contact numbers. And for oncology, don't forget to talk about the Macmillan nurse. Okay. So if you delay treatment, or you don't talk about the urgency of the treatment, if you fail to mention follow-up, you don't talk about the recurrence rate or potential complications, or you give incorrect reassurance that you're completely fine now, you're going to be completely cured, okay, and you do not refer to a MDT, then patient safety is also gone. Now coming to applied clinical knowledge. For cancer, vulval cancer, squamous cell carcinoma, well differentiated, the prognosis is good. Explain that this is a early cancer, so the treatment, it's localized, so the outcome is good. Then what about the management options? So wide local excision and lymph node if indicated. Then the staging, MDT discussion, you would discuss the prognosis and need for follow-up. And also, if you have time, you can advise on lifestyle and holistic care. That means skin care, hygiene, smoking cessation, if applicable, and sexual health support. Now, if you don't interpret the result of histology correctly, or you give an incorrect diagnosis, or if you fail to outline the treatment or mislead patients about management, you omit follow-up, don't talk about recurrence. If you show a poor understanding of prognostic factors, that means LVSI. If you fail, you don't understand what is the meaning of LVSI involved or not involved, then your applied clinical knowledge is also not good. Okay. So this is here basically about tips for breaking bad news. I already spoke to you about this, and this is some additional points of applied clinical knowledge that for vulval cancer, in addition to surgery, sometimes if it is a very huge mass, radiotherapy or chemotherapy is given prior to the surgery so that the mass becomes localized, and then surgery can be done for that. Okay. And in very rare cases, vulvectomy is done. If vulvectomy has been done, then you will ask for, like, counsel her about the difficulty in sex, and maybe she might need some reconstructive surgery later on, because vulvectomy is a very is a surgery causing a lot of morbidity. Okay. Now, usually there will be something called as a global score. So if they find that you are eliciting, like whatever I spoke to you about in information gathering, you are eliciting the history in detail, you're asking about bleeding, pain after the procedure has been done, you ask about the past history, any dermatological conditions, sexual function, or any psychological impact that she had. a candidate who speaks about all these things will have a clear pass. Okay. Communication skills, like I said, if you are very empathetic, you do the breaking bad news part very correctly, you check the understanding of the patient frequently, give reassurance, you answer all her concerns, it will be a clear pass. In patient safety, also allergies, referral to the multidisciplinary team, gynec-onco team, all this will give you a clear pass. And in applied clinical knowledge, also the need for surgery, like correct interpretation of the report, or what would be the management plan later on, and the staging and referral to MTT. So all, if you score all these points, definitely it will be a clear pass. If you miss out on 1 or 2 points, it would be borderline. And if you omit to ask about the presenting signs, if you fail to explore the relevant medical history, you don't know that she's a diabetic, you don't know she has any other conditions, then if you use inappropriate language, you just say this is a squamous cell carcinoma, you are not following the steps of breaking bad news. At the end of the discussion, the patient is very much confused. It would be a clear fail in communication skills. And if you give false reassurance, okay, you don't tell her that you will be referred to a multidisciplinary team, the surgery will be done here by my consultant. If you say something like this, applied clinical knowledge and patient safety, both are gone. Okay, so be very careful about interpreting the results, talking in layman's terms, checking frequently what is the understanding, and then talking about the management plan. Okay, so this is all in this station. Guys, believe in yourself, achieve whatever you want. Okay, and definitely you will succeed in this exam. Thank you so much for watching the video. I hope it was helpful to all of you.